You've had back pain, or you know somebody that's had back pain at some point in time in the past, and you're always worried about, or they're always worried about, well, I have a disc problem, it's a big problem, etc. Well, any back problem could have a disc involvement. So let's really talk about discs as related to back problems or neck problems. And when I talk about a disc, I mean anything in your neck, anything in your mid-back, or anything in your low back. But in some way, shape, or form, every back problem, every neck problem has some involvement of the disc. So let's talk a little bit about what a disc is for starters. Well, a disc is the cushion that sits in between the two vertebrae. So we have vertebrae, bones in our neck, in our upper back, in our spine. These bones are like little stones, little rocks that are stacked on top of each other. They're the spinal column. And the vertebrae is what gives us the structure, and the disc is what gives us the cushion. So it creates this cushion, almost like a shock absorber, in between the two bones so that they're not banging against each other. Also, the disc creates space in between the two vertebrae. So the space in between the two vertebrae is important because, as we'll talk about in a little bit, there's a nerve that comes out of that space, travels into your arm or your shoulder blade if it's your neck, your trunk if it's your upper back, and then your buttocks or your legs if it's your lower back. So the main purpose of the disc is to create that cushion and to create that space. I'll give you a picture of what a disc looks like. A disc is like a jelly donut. It has a round shape to it. It should be round, circular if you look at it from the top. If you look at it from the side, it should be oval shaped. It should almost be shaped like a football. In the center of that disc, there's fluid, just like jelly inside of a jelly donut. And then the disc itself is made up of many, many rings, kind of like the rings of a trunk of a tree if you were to cut it in half. Now, why is the disc important? Well, the disc is important because, as I said, it creates that space. The more space there is in between the vertebrae, the more space there is for the nerve to come out. The nerve branches off from the spinal cord, and in the case of your low back, runs down into your buttocks and down into a particular part of your leg. So the larger that disc is, the healthier that disc is, the more rings that are in that disc, the more fluid that's in that disc, the greater the space is going to be, the less the chance that you're going to have any pinching on that nerve. The disc also has the potential to absorb impact and make sure that the two bones are not rubbing against each other. As most people know, arthritis really comes from bones rubbing against each other. So when these two vertebrae are sitting closer to each other and we move in certain ways, there are times where those vertebrae, those bones, are going to rub against each other, and that by and of itself can cause some symptoms. Well, why do symptoms get started in the first place, and why do we always think that they're related to our disc? Well, again, the purpose of the disc is to create that space. So anytime there's more pressure on that disc, anytime that disc is itself putting pressure on something, whether it be a nerve or a muscle or some other soft tissue up and down your spine, you're going to have some symptoms. But also, anytime that space in between isn't as big as it needs to be and the bones start rubbing against each other, you have the potential for some symptoms as well. What are some different problems that can arise with discs? Well, you can start off in what would be termed a slipped or an irritated disc. And that's basically somebody that's got some, in the case of a low back, got some low back pain. It's probably centralized more in the center. It might spread off to the sides a little bit. But in some shape or fashion, the pain is coming from pressure on the spine, which ultimately is creating pressure on the disc. The pressure on the disc is putting pressure onto something, which is what's causing the pain. But the real problem isn't the disc. The real problem is what's causing that pressure on the disc in the first place. As that pressure continues, or it gets worse, or it doesn't go away, the disc will actually start to bulge. So again, imagine the analogy of the jelly donut. I have this donut that's on the counter and I put a little bit of pressure down onto it. The disc starts to get wider, it distends out to the side. That's what a bulging disc is. The fluid's all still inside of the disc, but the disc itself is sticking out. It's filling up some of that space where the nerve exits out. The disc got a little bit flatter, so the opening in between the two vertebrae is less. Now, if that progresses because the pressure stays, or it gets worse, or it doesn't get better, you can actually end up with what's called a herniated disc. Now, some of the fluid in that disc is beginning to leak out. So the rings in that disc of the wall got weakened, they broke, and now there's a little tiny hole and some of the fluid's just protruding out of that. So again, the jelly donut, I push harder on it, some of that jelly makes its way from the center out to the outside of that disc, and it's actually now leaking out. I can see the great jelly sticking out. That would be a herniated disc. A ruptured disc is all the way to the end. I just smashed down on that disc and the fluid and the jelly just came completely out. The disc completely loses its shape. There's now pressure on the nerve. The space in between the vertebrae is virtually non-existent, and I've got a much worse sense of symptoms. So how do those really progress? Well, again, in that slipped or that irritated disc, my back pain or my neck pain is going to be more centralized. It's going to be around my spine, maybe a little bit out into the muscles associated with the spine. As it gets a little bit worse and it progresses onto a little bit of a bulge, remember where the disc is kind of sticking out, now it's putting some pressure onto the nerve. So that pain is going to radiate more into my buttocks or into my shoulder or my shoulder blade. As it progresses and now the fluid starts leaking out a little bit with that herniated disc, I'm going to start to get some symptoms down into my arm. This achiness, this soreness, or down into my leg, this achiness, this soreness, or this pain that kind of radiates around my trunk. And as it progresses even further and becomes a ruptured disc, that's when you start to get the numbness, the tingling, the weakness, etc. So again, that's a progression of how things go. But the real question comes about, why is that disc what's causing the problem? The disc is putting pressure on something or allowing there to not be enough space, but you don't have the pressure off of the disc. And that's really where physical therapy comes in. The best way to treat a disc problem is to get the pressure off of the disc. Number one, it allows your symptoms to be less. Number two, it allows the disc itself to start to heal. And number three, it allows the disc to start to regenerate some of the fluid that's in it. Get that pressure off and your symptoms will not only get better and get less, but you will get better and the problem will go away. Mask those symptoms with some medication or something else, and the pressure is still there. The decreased space is still there. The disc may not be bothering you anymore, but the problem is still there and it's going to come right back. So one of the greatest things about our expert therapists here at Loudoun Sports Therapy Center is that they can get to the heart of why is that disc causing you the problem, whether it's in your neck, your upper back, or your lower back, and most importantly, what needs to be done to get the pressure off of that disc so that again, your symptoms can be less, the disc can heal. So click on the link below. Let's get you, if you're having problems, let's get them figured out, let's figure out why it's there, and let's get you in for an evaluation and get you started not only having less pain, but keeping that disc from getting worse and help it to heal.